Another thing, we're talking about new users, new consumers, and one of the things people are really concerned about, Dr. Giles, is how much do I use? Really concerned either that they're going to get high or they're not going to take enough or something like that. So how do you guide people who are new regarding dosage?
Yeah, it's a great question. And this is often I'll use science and then from there it becomes more of an art. But generally, when I'm looking at primary literature, so medical literature, as in papers either looking at cells in a petri dish or looking at lab rats, et cetera, animal studies, there will be this discussion of serum concentration. And based on bioavailability, how do you hit that serum concentration from an oral dosing, for example. So I go through all that nitty gritty detail and figure out weight based, how many milligrams per kilogram, and then what is that if you're absorbing 90%, what does that mean? So I'll kind of go through that and then go find what's essentially should be the lowest effective dose. It varies very widely based on the person's metabolism, based on the constituent itself, and based on the bioavailability as well as a person's absorption. So it's highly variable. In the lungs, we're going to absorb almost 100%, right? Orally, it's going to be less. If we could do IV, it would be 100%. That doesn't exist yet. I'm absolutely positive it will exist at some point. There will be intravenous cannabinoids, but we're not there yet because they're fatty molecules, which is difficult to administer in essentially water or saline. But we'll get there. I'm sure there's already been research. I think we've talked about that, Trey, but at this point that's not available. So from that perspective, yes, vaporizing is the best, but there are some other oral ways to get it higher, or you just compensate and take more orally to compensate for the 80 to 90% absorption versus 100%. Fats, fortunately, unless a person doesn't have a gallbladder or has really compromised digestion for another reason, fats are very effectively absorbed in the body. So even topically, so that's a good way to increase absorption. But essentially, we're looking for the lowest effective dose. I'll go through that with each of the conditions, what we've found to be the lowest effective dose or what is likely a good dose for somebody. It's always good to start there and escalate up as needed, but also realize that there's going to be a normal curve, so everyone's different and one size is not going to fit all. You're always going to have outliers on either side of that normal curve that need huge massive doses because they're ultra rapid metabolizers, and people who are extremely sensitive, probably very poor metabolizers that need little micro doses to have the same effect. And that's all in the person's genetics, in the person's metabolism, all of that. So you don't know who's in front of you, how they're going to metabolize, or the pharmacokinetics, pharmacodynamics of those molecules. But generally, the best way is to go with the lowest effective dose and adjust, titrate up or escalate up or titrate down based on them.
And of course, the saying in retail or with newbies is go low and slow. And it's really good advice. It's easy to remember. And so it's good advice for us to pass along to our consumers, right? Because not only does that keep you from getting underwater and too high and having a bad experience and maybe having an anxiety attack or something, it's not going to kill you, but it's going to make you uncomfortable. And we don't want them to be there. So not only does it keep you from going there, but it also helps some people realize this is a more economic choice than I thought it was going to be. Because really, my threshold is much lower than I anticipated. So on a quarter of what I thought was effective, I'm able to get the same effect. And you and I both have talked about the value of microdosing, and that's for some people, 2 milligrams makes a world of difference. They don't need a big, or even they don't need a 10 milligram serving that's considering a typical serving in the recreational space or adult use space. So we might come back to microdosing, but something to consider. You talked about one day
I'll also
cannabinoids.
say before we continue on is
Yeah,
you can always take more, you can't take less. Another
absolutely.
thing to think about.
And like you said, we're going to talk about what happens when you do get underwater, because there's some stuff that you can do. You can't turn the switch off, but you can help calm things a little bit.
Yep.
People who have taken our class might recognize you talked about one day that there might be IV uses for cannabinoids, and people who've taken some of our classes might recognize from the history that with the invention of the hypodermic needle, that really changed the view of cannabis, because all of a sudden cannabis was considered an inferior drug when it came to pain relief, because they had this brand new, never going to be a problem, won't be habitually addictive, won't cause anybody any harm, new product that was morphine, right, or morphine derivatives, and that could be injected, and that was going to be the answer to save everybody. And sadly, like so many things, we see, things come full circle, and you realize, gosh, it looks like medicine probably was on a good, much safer route before that came along. Obviously, there are needs for that sort of thing in trauma and in critical moments, but um, herbal medicine is, as you've insinuated, is inexact. And like you said, you don't know who's in front of you. So we always want to give advice that is general, but specific enough, keeps the risk down, and if possible, the cost down too, right?